Let's break down a real case in urgent care that highlights why pneumonia in the elderly can be subtle and dangerous. An 83-year-old male presents to urgent care with some vague symptoms. He's tired, talking in his sleep, a big change for him, has some left throat and ear pain, a bit more confused than usual, some fatigue and has some throat mucus. But oddly enough, he's not coughing much. Now, it's important to consider this patient's medical history: polycythemia vera, coronary artery disease, hypertension, and over the age of 65. Plus, he's taking Jakafi, which suppresses his immune system. Add in a recent visit from grandkids, and you've got several risk factors in play. Here's what's tricky. His physical exam is mostly normal, aside from a little forgetfulness. Labs, normal urine, normal electrolytes, negative strep. But his CBC shows elevated white blood cells, indicating bacterial infection. Also, a very subtle patch of pneumonia was identified on his chest imaging. So what's the takeaway? In immunocompromised patients, like those over 65 or on immunosuppressive meds, classic symptoms are often missing. No fever, no big cough. The immune system just isn't mounting a typical response in an immune-suppressed patient. Instead, you get vague signs, confusion, fatigue, and sleep changes. And they're not just at risk for typical bacteria. Think fungi, viruses like CMV, and atypical bugs you don't usually see. My advice: always have a low threshold for further workup in these patients. Get blood work and imaging every time. These folks can go downhill fast. Sepsis can creep up before you know it. Use screening tools like SOFA or SIRS from MD Calc to catch early signs of sepsis. Recognize it early, act fast, and you could save a life. Keep your eyes open for the subtle clues. That's how you'll make the diagnosis others might miss.